Please accept accordingly.
Okay, Omar, I'm going to count you down.
All right.
3, 2, 1, action.
Well, welcome to the Shops at the Shop workshop orientation for barbers and stylists. Today, we're going to address the issue of vaccine hesitancy in communities of color from a totally different perspective. Today, we got on the Zoom call, and we call it a town hall meeting. Funeral home directors and morticians from around the country. We know that funeral home directors and morticians are the last stop to this notion of vaccine hesitancy as well as death associated with COVID-19. So we want to hear from them and from their perspective what they see, what they hear, and what we can do to be more proactive in framing the issue for people so that they can understand the importance of getting vaccinated. I'm going to bring on my kind of co-host sidekick first to kind of introduce himself. My name's Omar Neal. I'm the moderator. I'm the former mayor of Tuskegee, Alabama, syndicated radio talk show host of You Got the Power, and moderator of Shops at the Shop. My sidekick is Dr. Stephen B. Thomas, better known as Dr. T. How you doing, Dr. T?
You know, Omar, I am doing great. And at the same time, I see storm clouds off in the distance. And I'm trying to keep my optimism up. But I'm getting also, I'm optimistic because I'm getting reports from the field from around the country, from Atlanta to Houston, Texas, all the way up to Madison, Wisconsin. Barbershops and salons are responding, my man. Even down there in Tuskegee, Alabama. I saw you on the news just a few days ago.
Absolutely, man. Well, you know, it's going to take all hands on deck. And that's what this is all about. All hands on deck as we began to truly engage our community, because we do know the consequence of people who are not protected through vaccination. And so we're not going to be coy about this. We're going to be very intentional about giving people the proper information, believing that when people get the proper information, they naturally gravitate to take care of themselves. And so what we're going to do now is, if we can do the word cloud, I think that would be an excellent thing. So as we introduce Dr. Close and crew, they can just look at the word cloud and kind of tell us what their word is. And the word cloud is what you're feeling. You know, we're going to put it up. You can go to the chat.
So let's see if let's take a moment here and see if they have the link in the chat.
Yeah, put the link in the chat.
And ladies and scholars, you can have as many words as you want. We're going to time this, just one word at a time. So click on that link. You can go in as a guest. You don't need to register or anything, and just one word at a time, but as many words as possible over the next 60 seconds.
Yeah, and for our panelists as well, you can put your word in, and then we're going to ask you about your word, and that is, what are you feeling now? What right at this moment? What kind of feeling are you experiencing? And that's what we want to talk about now. And then we're going to go into the conversation about the COVID-19 vaccinations, where the hesitancy lie, what strategies do we need to engage in, and then we want to do something even more important. We want to know, what do funeral home directors and morticians need to do your work and to be more engaging in the community as it relates to the issue of COVID vaccination, COVID-19 vaccination.
And Mr. Mayor, I just want to tell my staff behind the scenes that if anyone puts a word in the text, go ahead and add it for them in the word cloud. So there's a link. We want you to go to that link and add your word. So as many words as possible, one word at a time. and we watch this thing grow. You know, Omar, we're talking to health professionals that many times are not recognized as health professionals. And that are those professionals taking care of us at the end of the day.
Yeah, and it was Dr. Close, and I'm so glad to have him on, who said that, you're technically a part of the medical industry. You're the last step of it, but you are just as integral to it as anybody else. And I agree wholeheartedly. I never looked at it that way, but Dr. Close, you're correct. And what we want to do is make sure that funeral home directors and morticians get their due, get their respect and appreciation for what you do in our community. We value you. And so with that, go ahead, Doc. What were you saying?
I was just going to say, and that the barbers and stylists, when they hear from you, Harry Close and the team, it helps them when they hear people who come into their shops who've lost loved ones to this disease.
Absolutely. And I think that a lot of times that's when the reality sets in, is when people see someone close to them who succumbed to the disease. And so that's an area that we need to talk about. Let me introduce Dr. Harry Close. Dr. Close is a close friend of mine, pun intended. I don't know. I'm a poet and don't know it. I guess with that, I don't show it. So let me go on with Dr. Close. Man, I love you so much. Dr. Close is a Tuskegee man. He's a former board of director, a trustee of Tuskegee University. He heads up a national organization of funeral home directors and morticians. And he is a pastor and a owner of funeral homes. And he has been on with us on many occasions. We consider him one of our crew. And it's always happy to have him. Let me introduce Dr. Harry Close. How you doing, my friend?
I am doing well. I see I'm on this. I see the screen is blocking me, but let me just say it's always a pleasure to share with you and Dr. T and Mayor. We appreciate the opportunity to come with some of my colleagues that we can. First, I wanted to say to the barbers and hairstylists, thank you for once again allowing us to come into your shops or into your homes. All of us know that you are the country club for the inner city, or even if you're in the county, because it's the one place that we can learn and share and put down our hair, technically our hair down, and to share with learning from each other. But I'm glad tonight to have my colleagues across the country and they're from a different perspective of age and gender. But one thing we do, we deal with reality every day. And I'm glad to have them share with us today. And hopefully we'll be able to persuade some people that the reality what's out here now is real. That Delta variant is real. And we'll share some stories. And I have 2 cases this week of individuals who succumbed to that actual Delta virus.
I want you to introduce your organization, and then we're going to go around and introduce the panelists, Dr. Close. And then I want you to tell me, before you introduce your team, what your word was or is.
Well, I had a combination word, but the first word was disrespected. And I know that's a hard word for some people to accept, but where people have thought this COVID-19 pandemic was a joke, and now the people that are passing are the ones who didn't take the vaccine. And I have a couple family members, personal family members, who I've had a great conversation. I can't share what I said to them on the air in the vernacular in which I use, but I will say that disrespected with a slight of anger.
Well, Peter did do what I'm sure you did a little bit of as well. So we know that.
Yes.
Introduce your team, Dr. Close.
I have a great opportunity to introduce some of my colleagues. Mr. Mark Fisher, since he's right to my right, he is in Virginia, educator. Matter of fact, Mark just got off of the International Conference Examining Board, which actually one of the individuals that actually write the exam. So to help funeral directors become licensed. Below him is Mr. Sean Harvell out of New Jersey, who can really share when this pandemic first hit. He was one of the leads in that area. I will say as a young man, he's a funeral director's funeral director. Under 40 organization, the future of our industry, and it's a pleasure. Another under 40, Mr. Boyd from Alabama, who represents the under 40. When we say under 40, it's funeral directors under 40 years old. We have to train them, they're training us. Mr. Boyd will share later on, he's had the COVID-19 twice. So
Wow.
that'll be experience to share when his opportunity. Ms. Billy Watson Hughes, what can I say about Ms. Hughes? She's been president of every other organization we have in the industry. She taught, been on the state board, has brought wealth of information, and great confidant for me. And then my last colleague, but not least, is Gail DeWitt Thomas out of, I always get him mixed up, Gail DeWitt, Thomas DeWitt. But Gail also sat on the state board in Florida, appointed by the governor. She was president of the International Conference of Funeral Examining Board, which oversees all the state boards in North America. Hell of an bomber. She's also on the DMARC team. So when those disasters come across this country, she is one of the individuals that the government calls to handle those items. So all of us that are here are experienced bombers as well. And not to scare people, but I just ask my colleagues to be real frank today, because this is a real issue that sometimes people don't always want to recognize us, but let's recognize the issue. And it's, COVID-19 is real, but this Delta variant is real. And so I look forward to talking. I understand Dr. Cook's on and Dr. Ritter, so I just look forward to a great discussion as we go forward.
Absolutely. Dr. Carol Ritter, you want to introduce yourself? But she really needs no introduction as it relates to the team. She's a regular with us, and but try to just introduce yourself to the group and tell them who you are and what you do, and then give us your word.
Sure. I'm Carol Ritter. I'm a gynecologist, and so I have a women's perspective on the COVID vaccine, and I can talk about that. But basically, my word was being vigilant, and I didn't get it in the into the word cloud because I didn't know how to do that. But
we'll add that.
And I have to be vigilant because it's just constantly changing. And the pandemic in the beginning was 100% different conversation with the patients than it is now. The virus has changed 100%. It's like the original virus was bad, and then we had the alpha variant, which was 60% more contagious, and now we have the delta, which is 60% more contagious than the alpha, and if it keeps mutating, it's going to be 60% more contagious than the delta, and then we're going to keep Dr. Harry Close in business too much. So the conversation has been exhausting.
Yes.
But I had to be vigilant because we have to keep our compassion with the conversation because everyone's at a different place right now.
Yes.
One of the things that is interesting is the people who say it's my thing. I can do what I want to do. And given a virus, it doesn't work like that. We are all interrelated and interdependent, which means that you can not get the vaccine, and that's fine, you cannot take it. But then when the COVID finds you, then it can mutate, create another variant that can be negative to me.
Right.
And so, and so we need to really educate people about that. And we're going to talk with Mr. Board about his experience, because it's always, I think the best conversation is people who've been there, that they know firsthand what's happening. And the fact that Mr. Board is from Alabama, I'm a little biased and without apology. So, Mr. Board, you can open up your microphone and kind of introduce yourself to the team. You're under the 40 group, and tell us a little bit about your experience.
Absolutely. Again, my name is Cortez Boyd. I am a licensed funeral director, embalmer, and cremationist here in Birmingham, Alabama. So with my experience, I actually contracted the COVID-19 virus in the very beginning. It was around March of 2020. The mandates were just rolling out. Of course, we're meeting with families, embalming, of course, cases as COVID cases are coming in. And they're just now telling people to wear masks, and that funerals were going from 25 people to 10 people. However, in the midst of that, I began to feel sick. It's rushed to the hospital, and I have contracted COVID-19. At that time, it was very scary because there was nothing really known about the virus. There were no medicines really to treat the virus. The hospital was prepared, but they wasn't prepared. So the chief disease, infectious disease doctor was pretty much heading off my case at the hospital, which is normally where my medical doctor is. However, I had a very bad case. I was admitted into the ICU. Of course, had the breathing issues and contracted pneumonia. Probably was in the hospital maybe 2 weeks. Hospital did a great job with the medicines that they had prepared, and certain cocktails to kind of help fight the virus, and of course your body itself to heal on its own. So it was a very, very challenging time. I was probably off maybe a month from work. The funeral home was very, very busy without me, but I made it through. And outside of that, I caught COVID again, and in January of 2021. In both cases, I had no idea exactly where the virus was contracted or how I contracted the virus. Being a mortician, meeting with families, and also embalming decedents that have COVID-19, the virus itself, there's really no leeway where you can pinpoint exactly where you get that virus from. So it was very scary, very fearful during that time, but we made it through it. So that's kind of my story. I can kind of answer some questions.
Mr. Boyd.
Yes, sir.
At any juncture, did you get the vaccine, or that's what I wanted to know, since you part of this?
Yes, absolutely. So Alabama, fortunately, was one of the states to have the funeral directors included within the first wave of vaccines. So first you had healthcare workers and emergency response. And then they also included the funeral directors that were in close proximity of decedents with COVID-19. So I was able to get it at the end of January. Actually, I got the vaccine, and then that's when I found out that I had COVID for the second time.
Wow. Okay.
Amazing.
Dr. Close, tell the people the name of your organization, because we just got that question and want to make sure that they know it. And we'll go back to Mr. Boyd. You need to unmute yourself, Dr. Close.
That's the fourth habit. We're the National Funeral Directors and Mortician Association. We've been around since September 6, 1924, and we actually organized with Booker T. Washington in Boston, Massachusetts, August 23rd, 1900, with the National Business Negro League. And we are comprised of mostly African American. We do have about 15 different countries in Africa. We do have some Hispanic members. We are the persons that you last expect, always the first person you expect to be there. So we're your community leaders. Besides us burying your loved one, we are the support of our community. And that's why I was mentioning earlier to see these young practitioners, because they are the future. And to our community, I want to thank you for supporting us, not only during the time of need, but allowing us to support you, helping you with the limos to the polls that we did. We moved 538,000 people this past November for the election, which is nonpartisan. And I could break it down that we moved almost close to half and half, Republicans and Democrats. So that lets you know that we're a nonpartisan effort to make sure people can get their votes out. I wanted to make sure I get that out.
Thanks, Dr. Close. And Mr. Boyd, before you leave, how are you feeling? What word best describe how you feel before we move on?
I guess overall exhausted, you know. It's been a very trying year, not only for myself, but also serving families who've lost loved ones to it, seeing family members and other friends with COVID-19. So it's exhausted. We thought we were getting better, but now this, with the new Delta variant coming along, is kind of an eye opener to, you know, people really need to get the vaccine and make it better for us all. So I guess that's the word that I can say.
Yeah, thanks so much, man. Mr. Fisher, I want to bring you in because, you know, you've looked at this thing from a lot of angles. You have been on boards. You helped to construct tests that assess your industry. So you're looking at it from a panoramic view. I want to know, one is, what are you feeling now? That's the first thing. What are you feeling? And then secondly, what do you see happening in the community in terms of the hesitancy? Because the people who've already gotten the vaccine, that's one level. We know about that. But the people who are still hesitant, even after seeing over 600,000 people, or knowing that over 600,000 people have succumbed to COVID-19, knowing that this new Delta variant is present and even more virulent than the previous one, what are you seeing and why do you think people are still hesitant?
Okay, to answer your first question, my one word is optimistic. I'm a person that's always going to look at it has to get better. The statistics are showing us that the variant is worse. We know that. A lot of my businesses, both of them are in the inner city in Virginia. I'm saying that to say some of the world issues our lower economic, socioeconomic people aren't caring about. Not saying they don't know. They don't have the same care that we have. So they'll put themselves in a position thinking that I'm not vulnerable. I'm living in a bubble. They don't see that the true fact is, as I said before the show went on, I think most of us are old enough to remember before going to the first grade, we were lined up, they shot us in our arms, we still have the scars today, and we did not get sick. We're at that point in life now where we need that mandate. Everybody needs that vaccine because it is proven to save lives, and if you catch it, it will not be as bad as it can be. I'm in the stream of saying we need a mandate and every American needs to take this shot. Well,
you know, I think you would have a lot of people in the amen quarter with you, Mr. Fisher, and but we're talking about the fact that we have different states, and we politicize this, if you notice, and with the politicization and the disinformation, we got a whole lot of things conflated that probably makes that less likely than not, although you do have a lot of people who would agree. All right, let me go to Gail Thomas DeWitt. How are you doing?
Can't hear you, Gail.
Unmute yourself.
Unmute yourself. Now you want to put your camera on, and then you want to unmute yourself. I'm waiting for you.
So while she's doing that, oh, there she is.
I got you now. Now you see the little
Right.
oh, there you go. How are you doing?
Thank you. Doing well, thank you.
Good. What you feeling today? What's going on?
What's your word?
Commissioner
I
Moore?
am a little disgusted.
Okay.
The numbers in the state of Florida, as you well know, leads the United States now. And the lack of leadership, proper leadership, it's like the restrictions that should be in place aren't in place. It's almost as if they does not believe that the virus is real. You know, you have to ask people out of your space, no mask. And it's a little disgusting because it's really real. And if they don't believe it, they need to visit some of the funeral homes.
Let me ask this, Ms. DeWitt. When you're in a state where the leadership, political leadership, is cavalier about the virus, right? Doesn't that influence how people see it? And is that part of your frustration as well?
It is very much a part of the way people see us. Our mayor wants to put legislation in place, but his hands are tied.
Mhm.
And it shouldn't be that way. You know, we're walking around, we have common sense, and we should be willing to protect ourselves. So it's a lack of concern as well as the leadership.
You know, interesting enough, if Mr. Harvell, if I could have you unmute yourself and kind of, because I want to talk to young people, because this notion of invincibility seemingly is more prevalent in the youth of the younger people. What we are finding that more of the more senior of our citizens have already gotten the vaccine, and where the hesitancy lies or is more prominent is with people your age. Why is that?
Well, I think the bottom line is they feel that they are impervious to the virus. My generation and the generation after my generation, you know, we have a mentality of, well, it didn't happen to me, so, or it didn't happen to me yet, so it won't happen to me. And with that, that's the ignorance that they have, even to the point of when we were down and had to have a certain amount of individuals in the funeral home at one time. I literally had to have security because they felt that, hey, we could just come in and do what we want to willy-nilly in the funeral home. And I found myself getting into an exchange with them saying, hey, this is the pandemic. You know, people are dying. You're here because someone died of COVID-19. But it's a mentality of, well, it didn't happen to me. It don't have anything to do with me. It didn't affect me. So that mentality breeds the notion of, well, I don't have to be vaccinated. And they start to listen to the media and not really looking at the numbers, because when you look at that number of people that died, the large majority are Black and brown individuals.
Yep.
Okay. Even to the point, The Guardian did a story on some of us in our area, to where they said, well, the Black funeral homes were already in decline. How are they going to survive COVID-19? Because the Black funeral homes were overrun, and the Caucasian firms, they were just regular. It was amazing. My best friend, Ryan Buckland, his funeral home, he has a Caucasian firm nearly right there with him. And he's literally got 30, 40, 50 bodies, and they have 3. And it's like, it's unbelievable. It's unbelievable at how the ignorance to this virus and well, it can't happen to me, or won't happen to me, or I haven't gotten sick yet. Look how long it's been and I haven't contracted it yet.
Right. And
to see that, okay, now there's, another strand here. And with that mentality, we're in trouble.
Go ahead, Mr. Harvell.
And I think that's why one of my words was anxiety, because I'm fearful of having to relive what we just been through for 15 months.
Wow. Thanks, man. You have really set the stage. Miss Billy Watson Hughes, how are you doing? If you could unmute, I want to. You're getting me a little dizzy too. So I haven't had anything to drink, so yeah. So if you can unmute for me, I would appreciate it.
And you know, while she's doing that, I just there she goes.
There we go. All right. Well, you want to say something, Dr. T?
Well, I wanted to say to Sean that, and we'll come back and open up this conversation.
Yeah, that's what we want to do.
Yeah, because when you're in that moment, any of us who've been to a funeral, it's a sacred kind of space. And if the normative behavior in that sacred space is disrupted by what's going on in the pandemic and the attitudes you described, I mean, when you said security, that's really different.
That's different.
So we really got to sort through and uncouple a lot of this.
Right.
Hello, Miss Hughes.
Good evening.
How are you doing?
I'm doing just great.
You know, I'm always intrigued to talk to people who have been in something for a while and have seen it at all levels. You know, I know you've seen a lot of things in your life. Have you ever seen anything like this? And
No, not in the 51 years I've been working.
Not in 51 years. You've not seen anything.
Nothing to, emulate this.
Even AIDS.
And I think the problem is you've got so many unbelievers that it can happen to them or their family members. And that's what scares me, because I'm coming into contact every day now that I'm down here in North Carolina with people who are literally afraid to take the vaccine for fear that they will get the disease because they're not listening to the proper authorities on the vaccine.
So you're telling me that people are afraid to get the vaccine because they believe that the vaccine will give them the virus?
Yes. And they're not listening to the authorities, the doctors who are saying the vaccine does not contain the virus.
Right.
They're not listening to that.
Wow. So we got a lot of disinformation that's kind of permeating our communities, what you say.
Yes, a lot of it.
Yeah.
And then they're spreading ignorance too.
Yes.
Right. That's true.
Right. So let me ask you this. How are you feeling? What's your word? What you doing?
Mine was reluctancy, my first word, because I'm reluctant to try to deal with people who won't believe the truth. And, as much as we try to go out and educate people, we have workshops, we try to bring people into the funeral home. When we have arrangements conference going on, we try to talk to the family members about, did you get the vaccine? You need to get the vaccine, etc. And, they're reluctant to hear what we're saying, because it's not going to affect them.
Let me ask this, and I want all of you all to unmute yourself. I want to have a conversation, and I want to, at some juncture, I want to bring Dr. Tuesday Cook into this conversation as well. So if you all can figure out a way to get me one more person in, even if we have to bring somebody in. And then Dr. Ritter, I want you to help us out, because we got to find out a way to truly educate people where they believe the truth is the lie. Right? So we got to figure out how to do that. And I want to have this conversation. All right. So when people die from COVID, do they normally know that person died from COVID?
Yes, they do.
Yes.
You're telling me that they know people who die from COVID and then conclude that it can't happen to them?
Right.
Yes.
Right.
Correct.
Now that's a powerful message, isn't it?
Right.
I mean, because you would think that once a person have experienced death due to something, then that something would be something that they would want to avoid at all costs, right?
Correct.
Right. And so we do know this, and maybe I need to ask this question. Do they know that 99.5% of the people who are in the hospitals today with the variant, Delta variant, are non-vaccinated people? Do they know that?
I'm sure most of them do,
Yes.
but they don't care because
They
it's not
hear
going
it,
to
but
happen
they
to
don't
them.
process it.
They
Right.
don't, help me out. They said what? They don't
They
what?
hear it, but they do not process it.
They hear it, but do not process it.
Yeah, they hear it every day.
Mhm.
We even tell them in the funeral homes statistics like that, but they won't do anything.
But they're looking at the consequences right there in the funeral.
In the funeral home, you would think that if it's anybody I'm going to believe about something that can cause my death, is a funeral home director.
My friend, every morning I go to a certain 7-Eleven with a mask on. I'm the only customer in that store with a mask on. And it might be 40 or 50 people buying gas, coffee, or whatever. They think it's a joke.
Go ahead.
Dr.
Who wants to say something? All right, John, go ahead.
If your listening audience and the families we serve and the community we serve are listening to what we're saying as funeral directors, we don't want this type of business.
We sure don't.
Yes.
Because we are funeral directors that we get excited with death. Death is just an entity that we've been called to serve. But when you hear the funeral director saying, wear your mask, take the vaccine, because we deal with the end result every day. That's why most of us don't even watch television, because it's depressing, because we already know that we're going to see it in the morning. So I'm saying to the listening audience, like my colleagues and I, we'll serve you, but we can hinder this rapid growth of this death by just taking the vaccine, wearing a mask, and social distance.
Dr. Ritter, you're hearing this, and you have been listening attentively. What are you taking from this?
It's very interesting. I look at every individual that I talk to who hasn't had the vaccine. I never ask anymore, because in Maryland we have the Immunet service, so I can go on there and I can find out whether they had it or not. And if they haven't had it, I usually spend time trying to find out more, how have you gotten through this? And then if they bring it up, I discuss it. And most of the time it's this existential risk, right? It's not real. I mean, it's like their life is their life, and that life in the funeral home is that life, and they're not connected. So you get down to their basic fear. And from my point of view, it's under 40 and over 40 with women, so it's usually under 40. They're more afraid of not being able to get pregnant because they're afraid the vaccine is going to cause infertility. And then when I tell them, and this is like the wild, wild west out there with healthcare still, because I just found out today from one of my patients who's an employee at Hopkins, a student rather, at Hopkins, that the Hopkins has a mandate, but it has exceptions. And one of the exceptions is if you are pregnant or if you are trying to get pregnant. And that is not a CDC recommendation, but that's a Hopkins exception. So they're like, oh, if they gave that exception and I want to get pregnant, there must be something wrong with the vaccine.
Interesting.
Interesting.
And then I tell them, but do you know that the statistic is if you get COVID while you're pregnant in the United States, I'm not talking about other countries, I'm talking about the United States right now because the other countries are different. If you get COVID and you're pregnant, you have a 20 times more chance to die.
Wow.
So I'm sure you've seen pregnant women in your funeral home, because it's something about this virus and young women. We saw that with the J&J vaccine. So I tell them 20 times. If you're in another country, it's higher, the death rate. So it doesn't make you get the virus more susceptible to the virus. But if you get the virus when you're pregnant, you're 20 times more likely to die. And as we just heard, it's the lower socioeconomic people that are getting it. So you're going to have a higher population of Black pregnant women dying from the vaccine. And now Hopkins is complicit in this. I'm going to have to call them because I just found out this today. It makes the women think there must be something wrong with the vaccine.
So
we
Omar,
have a lot of work to do.
Omar, that's an example of how, and if the patient had not told Dr. Ritter that, we would not know. So here you have a policy at a major institution, world renowned,
Mhm.
with an exception that is not a CDC guideline, but that feeds into the very fear that we hear time and time again about infertility. I had no idea. And Dr.
Mhm.
Reed, we have to figure out how we respond, whether it's a letter to the CEO or letter to the something.
No,
Because
no, you need to go to somebody and you need to talk to them directly. We don't have time for letters. We need to really, we have to be proactive. We
you're
have
saying
to,
show up. You're saying show up.
Yeah,
yeah,
I'm
absolutely.
gonna, I'm
You
gonna
talk-
call them. Yeah, I
Right,
have
you
to
need to
call
do
them.
that. Right, you need to talk.
Brother O'Neill,
Yeah.
can I take it
Yeah.
a step further?
Uh-huh.
With the COVID-19, you know, we're talking about the, you know, the variant D, but you got to remember there's still people dying from the effects of COVID-19 from months ago.
Right.
And the funeral homes are still being overrun by that. And that's what people are not understanding, is that you have individuals who have contracted COVID, had gotten better, and then died because of the effects that took place inside of their bodies, right? And so now we're still dealing with those deaths. And now we're getting ready to have another, well, we already started having another uptick in deaths, because now here we are again. And so just look at this now. We were burying whole families. Like literally this thing wiped out whole families, right? And I'm trying to persuade my peers, you know, individuals in my age range. And I literally had pretty much a back and forth with a gentleman who he told me, oh, well, I'm not getting the vaccination. I don't believe in getting the vaccination, but he smokes marijuana and all that good stuff. So I said, well, you don't really know what's in the marijuana you smoke. I said, can you tell me what's in the Tylenol? He could tell me what's in the Tylenol. And so I said, wow, that's interesting, but you'll take one. But you won't take a vaccine that will save your life. What is the alternative? You worried about the effects of the vaccine. Well, what's the alternative? The alternative is pretty much death could be if you contract this.
Right. Let me ask something, Mr. Boyd. Why do people trust the streets more than they trust you guys?
Well, you know, people have what I've learned is that people like to, if one negative thing is said and 20 positive things, they're going to stick with the negative because it's one thing that they feel like they can hold on to. It's the reason why they won't do something or they won't get something. So it goes back to just like we were talking about with fertility in the women. I've actually heard that before, and people stick with that instead of looking at the 20 positive things that this vaccine can do to help you. It's for myself, as I'm vaccinated. It's a covering almost. It makes you feel better to go on with a mask on, but it's that one negative thing that I see from a lot of the millennials and I guess you could say generations that are under that they stick to what they are uneducated about before the educated part, or even go further to understand more about the vaccine and what it can do for you. It's hard to pinpoint why we want to stick with the negativity versus the positivity.
You know, if somebody can bring Dr. Cook up, I'm in one of you will probably have to just temporarily go off screen just for a second. If I can bring Dr. Cook up, and we have volunteer, Dr. Ritter, volunteer for a second. I'll bring you back, Dr. Ritter. So stay close. If I can bring Dr. Cook up a second, I want to talk with her about this, because if we don't do something, and I want you to realize that we are running against time, right? And if we don't do something, this can very well be an existential threat to many communities, right? And we need to be very deliberate about this. Dr. Tuesday Cook, how are you doing? Please unmute yourself.
I'm well, thank you. Good evening, everyone. Thank you for inviting me to come and speak with these esteemed colleagues. I'm so glad to be a part of it.
I want you to first of all introduce yourself, give us your word, and then I need to have a conversation with you.
Sure. My name is Dr. Tuesday Cook. I am a fellowship-trained, minimally invasive and bariatric surgeon, which means I do weight loss surgery through very tiny holes and ports. So I do cancer surgery through very tiny holes and ports with a monitor and long instruments, etc. I trained in Washington, D.C. At the Mecca, Howard University, and I also did my residency there. And then I did fellowship in Pennsylvania, and then came back to the DMV to serve people of color. And so I've been doing surgery, minimally invasive, cancer surgery, weight loss surgery for more than a decade. Actually, I'm getting kind of old now, so significantly more than a decade. And I enjoy it. And, I address COVID-19 from a little bit of a different perspective. I think multiple perspectives. One is from the perspective of we are adversely affected disproportionately by COVID-19. And that's for many, many reasons that go back historically about 400 years. But I'll let that slide because I know people here have addressed that already. But from another standpoint would be as a weight loss surgeon, obesity medicine is my specialty. I actually just passed my boards a couple of years ago just to do obesity medicine. And we are also, people of color are also at higher risk, and we have the most obesity in the country. States that have a prevalence of 35% or more include places like Alabama and Arkansas and Kentucky and Mississippi and Louisiana, South Carolina, places that have more than a third of their population with obesity, and obesity worsens outcome from COVID-19. Having obesity increases the risk of severe illness. People who are overweight are also at increased risk. It triples the risk of hospitalization from COVID-19. We already know that obesity is linked to impaired immune function. It decreases your lung capacity and your lung reserve. It can make ventilation difficult because people go on the vent. So people with obesity are at higher risk for getting it, have worse outcomes, and are at higher risk for death. Now, who gets obesity and who doesn't have access to weight loss surgery as much?
Us.
You got it. US, us.
Right.
We are the ones that have the comorbidities that are associated with obesity: hypertension, high cholesterol, type 2 diabetes, obstructive sleep apnea, osteoarthritis, you name it, we got it, because we also have obesity along with the things that go along with it. And so COVID-19 plus that for us equals a death sentence. And so a lot of my patients have come to the members of your organization because of the disproportionate care that we have access to and the increased obesity rates that we have. More than 900,000 adult COVID-19 hospitalizations occurred in the US beginning from November 2020 to, I want to say now. More than a third of the hospitalizations from COVID-19 were attributed to obesity. Right? So those numbers are important. And those numbers apply to us more than they apply to anyone else. People of the Black and Brown Latinx communities, we have worse outcomes from having obesity and lack of access to care.
My God.
Mm-hmm.
I can only suspect what your word is, but what is your word? What are you feeling?
Well, I did two words, and they're linked. Mine was cautiously relieved. And so, I was happy. I worked all throughout the pandemic. And so I saw a lot of deaths and a lot of people who couldn't even get to a funeral home. My mom is in New York, and so, they had ways in which you could go to New York and work, and you could work in Maryland. I did a lot of work in Maryland, but also kept in close contact with New York and my colleagues, and the bodies that were piled up outside of the hospitals in vans and then outside of vans, because there were just so many deaths, was nerve-wracking to me as a person, as a Black person, and as a physician. People think that doctors just do it and then we're just fine. And that's not the case. We are not used to that many deaths. We are used to taking care of people and them going home. We're used to, at the end of the day, people come to the office and come to the hospital. We do what we need to, even with their cancers. We catch it early, we cut it out, and we can send them home happily. Most people do well. Most people have good outcomes. So to see this number of people with poor outcomes was very, very difficult and anxiety causing and depressing for me, because no matter what we could do, no matter what we did, we weren't getting the outcomes we were used to. And it's physicians, we're people too. We're going to have PTSD for a long time. And so my words were, cautiously relieved because we see a lot less deaths with the vaccinations, and so I still wrap my head around people not wanting to get it. I understand the history of medical apartheid in this country. I understand the disproportionate access to care and broadband for people in rural areas. People, not being able to take time off from work or have childcare so they can go do what they need to do for their healthcare. But when we get to the conspiracy theories is when I start to have a little bit of angst, because there are so many things that show that having the vaccine improves outcomes. It's a simple statement. People who are vaccinated are 4.5%, have a 4.5% chance of getting really, really ill and dying. 4.5% chance, right? So for me, seeing the decrease in deaths and the decrease in ICU, I took a picture the other day, maybe like about 6 months ago, of the ICU with empty beds. That was almost unheard of. Empty beds, this was amazing. Once people started getting vaccinated, people could go outside, live a little bit. People didn't want to even walk outside. And so, I'm okay with hesitation. I'm happy for education. I'm happy that once people get education, from people that are trusted sources, the CDC, your primary care doctor, your healthcare worker at the shop, once you get important and informed, educated information from someone you trust, I would then think that people would make a decision that's based on that information. So when it's based on all kinds of other things, it makes me cautious, because the Delta variant is also something that's around and it's not going to get better. Luckily, if you've had 2 shots, you have an 88% chance of immunity against the Delta variant, right? If you've had one, I think you have like a 30-something% chance. If you have both shots, you have 88% chance against the Delta variant. So, 90 to 95% of people who are hospitalized or dying now are people who were not vaccinated. I mean, these are important numbers, I think, for people to know. So I'll stop. So those are my words.
I think, the reason why we bring you on is by popular demand, right?
Your stipend is in the mail.
Mr. Witt, I want to, Dr. Cook hit on some salient points. One is, it's not that people don't know, it's probably who they trust. It may be how we frame the issue, because how you frame the issue determines who embraces the cause. Have we just missed it in terms of framing the issue properly? Have we not been as intentional and creative about reaching our people? Is it something that we're doing or not doing that's causing for this hesitancy? And at this point, what's your thoughts?
It's a great mystery, because we educate our people. They know, but sometimes I just feel like they just really don't care. And then you have the other group who are afraid to trust someone in order to get the vaccine. It's just confusing. It's confusing for me, because I've talked to, I'm just blue in the face. It's like, I'm not gonna get it, they all the misbelief. And I think it goes back to our inheritance, with that mentality.
Wait, stay there for a little bit. Our inheritance. Drill down on that a little bit. Unpack that for my young student.
Well, I think it goes back to slavery. We were always tossed against each other, and the beliefs we didn't trust. And I feel like it's present. We don't trust each other. I mean, as a group of people, we don't trust. So how do you fix it? Is it fixable?
And I think that's the conversation. Mr. Fisher, help me out with this, because we're talking about, I had last Thursday when we did a workshop, I had my daughter's pediatrician. And I recall it was like she was a week or so old. And when we took her to the doctor for her first appointment, and she gave her several shots that first, and she's 2 weeks old, right? And I trusted, what she said to me, that my daughter needed the shots to protect her from these other things. And so the lady who I trusted to give her several shots was on this particular forum a week ago. Why don't we trust people like you and physicians anymore, Mr. Bishop?
Truthfully, to not piggyback on what Gail said,
But
our issues of trust are so deep, and our modern day average person will believe what they see on Facebook or social media versus what a trained professional will tell them. We have so many distractions now that the truth comes secondary. And it's like some of them can't discern what is truth and what is foolishness.
That's right.
I guess my mother used to say, common sense is a flower that doesn't blossom in everyone's garden.
I like
just
that
gonna
one.
leave
I'm
that
gonna
right
take
there.
that one from you, Mr. Mark Fisher. I just velocity just took place.
But common sense has to kick in at some time, especially when you're going to funerals and your loved ones, your friends, you see them in the casket and you still won't trust and believe. We can understand the conspiracy of Tuskegee. We know it happened, but
Right.
so many people have had this shot down. You don't see adverse effects. So just look at it. We have taken the shot, both. We're still walking, we're still talking, we haven't turned green, we haven't lost our fingers. I mean, they need to just analyze what is happening and get the vaccination.
Well, I think that you made a salient point. One is 600,000 people that we know have died from COVID. We don't know how many people who may have succumbed to the vaccine. We don't know that, but it certainly can't be that many, because if it were, we would know that, right?
Yes,
right?
we would know.
Right. So let me ask this by show of hands. How many of you had the vaccine? Is that unanimous? Dr. Thomas, I didn't see your hand. What's wrong?
yeah,
Put your hand up.
I might need a third one. The way they talking.
So I mean, why can't they believe us? I don't understand that. Dr. Ritter, help me out.
So I just want to share a conversation I had with a patient this week, and I'm a gynecologist, remember. And I told you I already know, I knew that this woman wasn't immunized when I went in. I didn't talk about the vaccine when I went in. I talked about the concerns that she had at the moment. More than just gynecology, I could see from her image that she was depressed. She was thin, she was gaunt, she was, cachectic. She has gone to a lot of doctors. So I talked to her about how she was feeling. And then she brought it up and she says, and why do all these doctors care so much about me now to get the vaccine when they didn't care about me when I was asking them about my fatigue and my thyroid and my this, and they didn't pay attention to me at all.
That's powerful.
So
here we go.
That's powerful.
There we go.
Now I think you're hitting on something. That's a salient point. And I didn't want to cut you off, but you really hit something. Now I want to have that conversation.
She was willing to listen to what I had to say about the vaccine after that. She said, you're the first person that I listened to. So, but I had to get through that.
Yeah, open up, everybody open up.
So essentially, she just wanted to feel heard. She wanted to feel heard and she wanted to feel seen. And
she's also dealing with this, Dr. Cole. Why do you care about this when you didn't care about that? That's what fuels the cynicism. It's not logical. What's in it for you?
Correct.
Why are you doing this? Because obviously you don't care about me.
Right.
I mean,
I'm affected.
Oh, right. So what is it? When somebody give you something and you know that they normally give you something, then you look at that something and you say, well, what's the catch?
Mm.
Is that Sean, help me out. You know, Cortez, I mean, I want to see from a young person's perspective too. I mean, does that make sense to you? That people say, well, you know, hey, you'll never look out for me in other ways. Why you want me to do this?
Absolutely. And it goes back to even in you know, in our profession, you know, the funeral director, they just look at us as that, hey, the more people pass away, the more revenue you have. But it goes back to, we don't want this type of revenue because this isn't normal. Okay. Even the customs on how we do services aren't normal anymore because we can't have the funerals the way that we want to. And to the point that we were down with nobody could not come. So you pretty much was picking loved ones up and either burying or cremating without any type of ritual at all. And so they just can't understand, how is it a funeral director who makes money off of death telling me that I need to be vaccinated? Wait a minute. What
Right.
did it for you? Right?
And can I come to Sean on one point?
Go ahead, Dr. Close.
Our convention is next week, starts next week. We're going to be memorializing at least 50 to 60 funeral directors who lost their life serving families during this pandemic. And Association Press called me today and said, how many of your members died of Delta? I said, I don't know the statistic yet. Give me a week. Imagine that they're calling the funeral directors winning how many of their colleagues died. And I just want to follow up. I said earlier that I was used the word disrespected. And let me give you why I use that word. Not taking the virus, totally
the vaccine.
Not vaccine, excuse me, not taking the vaccine totally disrespects life. I mean, there's nothing else you could say. So if you love life, you're gonna want to take that vaccine that you can have life, because any other choice is not taking it, as the people who are in the hospital now realize they wish they had taken it. Even these politicians that were spinning it not to take it, they have taken it. So if nothing else comes from the listening audience, you need to take that vaccine. And
You know,
hear,
go ahead. Continue.
No, so, you know, and it goes back to again to Dr. Cook and Dr. Rick. You know we have a strong healthcare system in this country, but if you can't afford to pay for the premiums nor the deductible, which is certain segments of this country are going to be affected, that's why this disease, as many others, have taken people out, because they can't afford the healthcare system that we have in place. Now, that's a whole big discussion to have. But when you have funeral directors and physicians saying the same thing in different ways, we need to address it.
Well, you know, one of the things too, if you see this is a pandemic of the unvaccinated, right? And so I think that may be a way we need to reframe it. I mean, you know, you are more vulnerable now. One is we are opening up society now, so the public health mitigation measures are no longer imposed unless they're self-imposed. So you are out there more vulnerable than you were when the first virus came out.
Well,
right?
let me say this. My governor, thank God, Governor Hogan has put back state of emergency in Maryland.
I saw that.
It's a state of emergency.
I saw that announcement.
So I will give him kudos for that. I mean, because it makes sense. I think a lot of these states opened too early. And I'll be honest, I just left Florida this past weekend burying a nephew. I'm going to Texas with a lot of my colleagues on here. Texas opened up early, and 3 states make up 40% of the world cases right now are Texas, Florida, and Missouri.
Yep.
Scary. you know, and people don't believe this is real. Well, the funeral directors and the physicians on here are telling you this is real.
This is what I want to do. We got about 25 minutes. Let's talk about solutions. What do you need? What do you need from us? What do you need from the White House? This is a White House initiative, so everybody needs to know that. How can we be of assistance to you? Because you are very important to this equation. And so we want to know what you need.
Well,
Can I say?
Go ahead.
And
I
just
comment
let me
from one
say to Mr. Lamb, we're going to come to you, Mr. Lamb. So keep your hand up. We're coming to you. Go ahead, Omar.
Go ahead.
Sean, do you mind if I go ahead for that answer? And
Yeah,
I'm gonna
you go first and I'll come behind.
Yes, sir. We would like to do the same type of initiative that the Barbers and Hairstylists. Now, we have a foundation called the Funeral Service Institute for Public Policy, and that's the outreach in our community. And so, you know, we always gonna need resource finances as well to reach that with whatever program that we can implement to reach, because every funeral director touches their total community within a year and a half, as well as what we would need from the White House. And I said this last time we were on air, not some PSA from NIH and CDC. We want resources and connections with those particular agencies, because the funeral directors are the last resort of the health system in our community. And the results are necessary no matter who's sitting. Hopefully the Biden-Harris administration hears us. But we, as funeral directors, are the community. No disrespect to my colleagues who are physicians that are vital, but we deal with that community 24/7. Even as a pastor, I deal with more people who don't know any type of religion because I have to serve them despite that. And so the funeral directors are your last defense for anything. And, you know, we can get some assistance from the White House through this foundation that we can touch each community. It will be great. Finances, yes. Resources, yes. And thank you, Sean, for letting me. Sean is my also district governor in the Northeast corridor for me under my administration. So I really appreciate him. And I'll yield to my colleague.
I'm going to come in from another perspective. We've had different viruses and different pathogens before, right? But the way they were handled from the top, which was much different than this was handled, okay? And so when you flirt and play games with people, this is the outcome you get because the trust has been broken, okay? It doesn't matter your political affiliation or what have you. When there's something like this involved, we all have to be honest and truthful and say, you know what, despite how you feel about me, how I feel about you politically, we have an issue that we need to tackle together. And when that did not start out right, it created what we have now, okay? And so individuals, millennials, you know, we're watching TV, you're watching CNN and this and that, and you hear individuals going back and forth with doctors, telling doctors they're outright lying, right? And you're watching this, so you don't know where you're supposed to fall, okay? And all you know is that you want to live, but it didn't start right. And so now here we are, the funeral directors and physicians, we have a heavy lift because now we're out here on the ground trying to get individuals to get vaccinated, telling them, look at what's happening, look at what's going on, and trying to restore the trust when really we didn't break the trust, okay? At the top, it wasn't dealt with correctly. And so now here we are today, still, you know, teeter-tottering with the numbers, still teeter-tottering, you know, well, I don't know if I should take it. I don't know about this. I don't know about that, because what got into my ears, itching ears, what's there? And so it's this distrust. I don't know who to believe. So if I don't know who to believe, what do? I do nothing.
When in doubt, don't. Huh? And that's
Right.
kind of what's happening. Ms. Lamb, you
And so
had a
that's what
question.
we're fighting against.
Yeah, Ms. Lamb, you had a question. What's your question?
And tell us who
No,
you are,
I
Ms.
didn't have
Lamb.
a question. You guys asked who all had been vaccinated. I didn't have a picture up, so I threw the hand up. But what I want to say, I'm a barbershop owner in Cincinnati, Ohio.
All right.
And some of the things I've been telling my clients and clients that comes in, because I'm still under COVID restriction, I decided to keep it like that. Although they opened everything back up, I have to protect myself. I'm an asthmatic, and I just want to protect myself, my coworkers, and people that come in. But what I've been, because I am scheduled to do the shots in the shop on August 14th, and what I've been explaining and talking to the clients about is when we were younger, we had to get vaccinated. If you have a condition like mine, I have to get vaccinated for the flu, and I don't know what's in all that stuff. Okay. But what I know is, although I've had the flu and I've had pneumonia, I don't have it as bad. So that's how I kind of talk to them and explain things to them, that this is needed. And we'll never open back up fully the world until everyone gets vaccinated.
Well,
know,
thank you for what you do. Thank you so much. And so excited that you're going to have a vaccine clinic in your shop.
August 14th. Yes, I'm pretty hyped about it.
That's good. That's
So,
wonderful. You know, we have Aaron. Aaron, we want to hear your voice, man. We appreciate you and the work you're doing. You're hearing what the funeral home directors and morticians are saying. What's your take?
You know, I had a very difficult well, first of all, my word is perplexed. I don't know if it made it in the cloud.
And also introduce yourself.
Oh, yes.
I assume that because you hang out with it, everybody knows.
Yeah, I'm Aaron Perry. I live in Madison, Wisconsin, and I've had the pleasure of opening up 2 health centers and barbershops here, and it's going very well. But one of the sacred things about the barbershop is we don't shame, we don't make people feel guilty. And I failed this week because my brother, I love this guy. We grew up together. He knows that I trust him. He knows that if I say something to him, it's coming from the heart, but he's not vaccinated. And so I had a hard conversation with him. I told him, I said, man, I love you too much not to have this conversation, but I also love you too much not to put this financial burden on your family. Do you have burial insurance? And that was hard. And he didn't like it. He's dug in, but I said, do you have burial insurance, my brother? And I'm going to stick to that because I love this guy too much to not have this conversation. But I know that he's calling every family member feeling some kind of way. But my sister did text me that he's kind of leaning towards getting vaccinated, but that wasn't my intention to shame him. I'm just letting them know this is real.
Yeah, it's real.
You know, and so having the funeral home, folks on tonight was, when I said, gosh, this happened this week with me, but that was a hard conversation that I had. And I hope people continue to have that with folks, but that's the reality. Some people that are poor who get COVID and pass on, that's a financial burden that's passed on to their family.
Right. That's right. That's
You know,
right.
one of the thanks, Mr. Perry. I think that at this juncture, we need to probably forego some of the niceties. It's just like if the house is on fire, we don't say, you know what, the house is on fire. I think we should get out and remove ourselves from the premises. We say the house on fire, man, let's get out of here.
Yeah.
Right?
Yeah.
I don't think we have the sense of urgency, right? That we need to have that let people know that this is real. Maybe we too cool. What is that a fair assessment? Mark, help me out. What you think?
Yeah, I think if you remember the show Scared Straight back in the 70s.
Yeah, I remember that.
I think the technique that guy used about asking about burial insurance, yeah, we need to go just like that, shock the brain and let them realize this is serious. It's not a joke.
Yeah.
I want you to know that after some of our town halls and the conversations that we've had here in this space, I've gotten emails from people, sometimes family members, to say, cousin so-and-so, listen to the town hall, and it moved them from hell no to where do they sign up. So, and that was just listening to a conversation.
Mm,
The other I saw, one of our stylists was being interviewed by a news show, and she's doing hair while she's being interviewed. So the person in the chair is listening to all the back and forth. Do you
mm,
know after the interview, Katrina calls me back and says, Miss Smith, who was in the chair, she's now decided to get vaccinated. She's going to come back for the clinic. No
mm,
shame, no blame. We've been using this approach of the
mm,
conversation. I've learned that from Omar,
mm,
giving people a chance to make an informed decision. This is why the coming mandates become an issue. Will
mm,
mandates push people further into hell no? Or will mandates bring them
mm,
to make the decision? We actually have a poll,
mm.
and we like to know
But
what
think
you
about
think.
this, Doc. Just, I want this to be conversation.
Yep.
Is it a mandate if I say you can't come in this unless you are vaccinated? Is that a mandate? Because that now becomes optional, right?
That's may well be that businesses impose mandates. Hospitals.
Sports events.
Yes. Other
Things
countries.
like that where people where it could be a super spreader event, right?
Other
That
countries.
create some restrictions there. Is that the same as a mandate?
Yes.
Don't
How does that work?
Other
So what-
countries.
All right.
Other countries around the world have not only put those systems in place, but they have a verification mechanism.
Yeah,
You have to show verification on your phone.
yeah,
Those countries that have gotten this under control, that's what they do.
yeah.
That way, Ms. Hughes, when you're walking into a facility with other people, because of all those checks and balances, you can be assured you're going to be safe there. We don't do that here.
No, we don't.
No.
Now,
And it's unfair. It's unfair to everybody because we do not have anything in place.
And those of you who live in states like Florida, your elected officials have made it, ready for this, illegal to even ask. Why would you pass a law to make it illegal to ask? Why would you do that?
Well, they're saying people that make it illegal to give somebody water that's trying to vote. I digress. I'm sorry.
They can't vote if they're dead.
They can't vote if you're dead. You're right.
Yeah.
Omar, we need to do this poll. Goshan, do you have it ready? Now, while she's setting that up, tomorrow there's a huge debate on whether or not universities should make COVID vaccines mandated. Now, in the chat, you're going to see a link, and you can go in and go ahead and place your vote. So go ahead and place your vote while we're continuing the conversation. The University of Maryland has such a mandate, Omar. All faculty, staff, and students must be vaccinated in order to come back on campus. There are places around the country where staff have lost their jobs because they have not been vaccinated. That's what's coming.
Well, think about it, Dr. T. Think about this. When you go to school, your children have to have their vaccination before they go to school, right? This is elementary school, high school. Isn't that the same thing? What's different about that? Tell me the difference.
There is none.
Yeah.
I mean, haven't we always had to have vaccinations? Who was that telling me what we used to do when we were growing up? Was that you, Mr. Fisher?
That was
those who remember when we got lined up.
When we got lined up, you remember that? I mean, so if schools did it then, what makes it illegal now, or what makes it wrong now to make sure that you're protecting the environment? Because technically, you are respecting the environment. When people come to your facility, whether or not it's a barber shop or hair salon or school or wherever, they want to be safe, and they want to know that you're making provisions for their safety. And so I think you can take the onus upon yourself to say, we want to make sure everybody's safe here. How do we do that? We need to be vaccinated.
I think that's a good point. Mayor Neal, what's interesting is in France, people who are not vaccinated will no longer be able to go to restaurants or cafes or cinemas, museums. They'll have to submit. They have to quarantine at home, and they have to actually submit a negative test, which they're not even going to let be free anymore. is going to be 49 euros, which is more than like 50 bucks US, you know, euros is a high exchange rate, or 20 for the PCR and 29 euros for the antigen. So they're going to have to pay for their test, and they're not going to be able to go to any public spaces unless they're vaccinated. They have to quarantine at home. So somebody who works in a hospital will not be able to work in a hospital unless they're vaccinated. And that's from their president.
So, there is something, Omar, that we should put on the table that is legitimate, that the current vaccines currently are under emergency use authorization. Okay. Now, it will only be a matter of weeks, not months, that one or more of the vaccines will be officially licensed. Once it's licensed, trust me, hospitals, nursing homes, places like that will simply say all workers need, because they do it now for flu, need to be vaccinated. That's coming. But if we lose the battle of persuasion and people think, because there is that counter narrative, Omar, that we're not talking about as much, we don't want to elevate it. They're already, I say they have salted the fields, saying that the government is trying to tell you what to do. The government is knocking on your door like Nazis. They use that kind of language when public health professionals are literally going door to door to try to help answer people's questions. So we haven't prepared for that fight. It's coming. Now look at this. If everybody voted, 100% of y'all would support mandates. That's amazing. Now, I don't know if 6 months ago you'd still be there, but they're there now. And I think a lot of it's because what people are seeing with their own eyes in real time.
You know, people want to be safe now. It's time out for, you know, one is we know that we've had over 200 million people get vaccinated, right? We've had enough time. Dr. Cook, help me out with this. If you get vaccinated, normally within the first week or two, you're gonna, whatever ill effects, you're gonna probably experience those pretty early in the vaccination. Is that correct?
That's correct. And it's usually after the second dose when your antibody, when your body has already been exposed to that antigen, that vaccine, that you can have things like redness at the site, soreness at the site. You may have some fevers or chills, a little fatigue, a little muscle aches, and that all those things generally go away in about 48 hours. So when people told me they're going to get their second dose, I was ready. I had my ibuprofen and I had my blankets, and I actually didn't have any ill effects after my second dose, but some people do. And usually it's people under 40, because we have such robust, well, I'm not we no more, but people under 40 have such robust, immune systems that they're like, oh, I've seen this before. And so you start to make those antibodies and you start to get the, these symptoms. But again, it lasts about 48 hours, if at all. And then after that, you may have, a lymph node that's there and that kind of stuff. But any ill effects you have will resolve, after that.
So, so after 6 months, the likelihood of something coming up as a result of your vaccination is pretty remote, right?
It's slim to none. It's slim to none. And what I want to highlight too, I want to make sure that I put this out there based on what Dr. Ritter said. We keep focusing on us and how we don't trust and we're not going on the science. And I know a lot of people, I'm a physician and I'm a Black physician, and I have a lot of Black physician colleagues and Black friends. And, in some cases, it's not us. That policy put out by Hopkins disturbs me a bit, because as much as we are talking about scientific journals and articles and talking to the general population about science and making it, clear and answering questions, this is a scientific institution that is saying if you're pregnant or looking to become pregnant, don't get vaccinated. That's a real problem. Three of the highest courts or organizations in the land with regards to pregnancy, fertility, ACOG, CDC. I don't remember the one for MFN, Dr. Ritter, if you remember, but three of them agreed on this. To get three huge organizations to agree on anything, that's a big deal. Yeah, three of them agree that it's safe. It's safe in pregnancy, and it's safe for fetus, and it's safe. I attended webinars. It's safe for people who are lactating to be able to feed their babies. It's safe. So for them to, institution that puts out papers, scientific journals, for them to say, well, you cannot do it if that again, that does not engender trust.
Yeah, we
That
have
does
a
not
lot of work
engender
to do.
trust. It doesn't make us all streamlined in what the data says. So that disturbs me a
It
bit.
makes you think, what do they know we don't
If we
know?
don't know, absolutely.
So we're going to send this upstream, as
Mm.
Omar said, this White House initiative. They need to know on the ground, and that
Yeah.
way we're not constantly blaming the people,
Right.
because there's been confusion among us.
Yeah. Yeah.
Scientists, physicians, people you're supposed to trust.
Well, you know, Doc, if you notice that the clock on the wall says we're 4 minutes away from it.
Can't believe it, man.
I can't believe it. Hour and a half. You see how quickly it goes by. So what we're going to do is we're going to go around and give our short closing remarks. Let me say this, and I want to ask Dr. T on the spot. I like to have this group back at some point. I want to do this again because this is so rich, and I just want to figure out how we can do this.
Well, Omar, just think about it. Dr. Ritter described being a gynecologist. She's delivering babies. She's at the front of the line when birth happens.
Right.
Now we got Dr. Harry Close and his team at the end of the line. And in the between, we got the barbers and stylists trying to, you know what I mean? I think we should always have representation from those two ends of the spectrum of life.
We want to really we want to keep them involved. Dr. Close, we want to keep you close. I can't help you.
Okay.
All right. All right. So let's figure out how we can continue to engage this group as panelists. Let's go around. We're gonna start with you. I'm gonna end with you, Dr. Close. Mr. Mark Fisher, your last closing comments. Let me say what the closing comments. What you want to leave people with, because that's normally the most profound.
The Delta variant is serious. I do not want to make money serving families that die from it when they can take a vaccine and live and have a happy life. I want people to know that we are serious and honest with you. My funeral home has been full of nothing but COVID remains at one time. Come on now. A single virus caused this. We now have a method that can keep us from catching it. Please take the vaccine.
Thank you so much, Mr. Fisher. Dr. Ritter.
Yes, I believe that we continue to educate ourselves and each other, being vigilant with this education and finding our own truth. And we need to be vigilant amongst the healthcare professionals too, because like Dr. Cook said, we are part of this confused equation. And it's been like a ship without a rudder at times. So we need to find our rudder and get the job done with educating ourselves and others continually. Citizen virologist.
Thank you so much, Dr. Ritter. Miss Gail Thomas DeWitt.
I would like for them to take an open look and compare non-vaccinated against the vaccinated. I mean, there are a few people who have died who have been vaccinated, and there are a lot more people who died who didn't have a vaccination at all. I mean, it's the truth. Look at it, get your vaccine so you can live a fruitful life and we not have to hibernate. Because when you think about it, if you go out and live carelessly, reckless, and come to my house, you can infect me, who's trying to live an honest, safe life. So we are our brother's keeper, and we really need to push forward, help each other, educate each other, and maybe get out into the masses and walk door to door, especially for our elderly people, you know, who are really afraid.
Thank you so much for your profound comments. Dr. Two Speaker.
I guess my last words, since we know everyone here is a proponent for vaccination, my last words really would be alluding to something I mentioned earlier. As physicians, we definitely will have anxiety and PTSD from seeing so many people die, but so will you. People who are in the general population watching this madness on TV, knowing that you probably have a family member that passed away, your job situation, your access to mostly everything, these PPP loans that were difficult to obtain, how your business did. Some people's businesses have closed. So between death of family members, difficulty with access to your finances, financial stability, and even all of you who are part of the Association of Funeral Directors and Morticians, if you feel like you need a little bit of help, mental health is very important, and we can't help anyone out here, not these stylists in these salons and barbershops, not anyone, not families who are grieving if our own mental health is not taken care of and stable. So, in our communities, we have a big stigma against seeking help. Just pray, God will do it. Now I pray, Lord, I pray all day, every day. But there's a reason why God has enabled us to be able to get to people for whom this is their expertise to help us through these difficult times. And these are truly difficult times. So seek help. Make sure your mental health is just as on par as your physical health.
Thank you so much, Dr. Cook. Aaron Perry.
There's so much misleading information out here. I did come across information I think we all should share. It's a Facebook page for young widowers and widows. I think that's the information that needs to be put out here so that we can see the pain and the sadness as a result of this, because I think people truly want to live. And I think that's the information that we need to continue to put out there, is letting people know this is real. So there's a Facebook page of young widows and widowers of COVID-19.
Thank you so much, Mr. Perry. Mr. Cortez Board, Alabama man, my Alabama brother.
Absolutely. The last thing I have to say is my colleagues and those who've already said, just gather the facts, continue to spread the facts of vaccination to the unvaccinated. And then I think that as together, we have to come together as we've done long before and push that this is something that you should do. When people believe and when people know that you care about them, somebody will listen. If you touch one person, it'll trickle down to someone else. We just have to come together, push the facts, and make sure that we continue on until it gets better.
Thank you, my brother. Ms. Billy Watson Hughes.
I think we're going to have to start canvassing our communities and let them know the truth about the vaccine, and that we need to encourage them that they have to take it. And if we have to stress how many deaths we have dealt with, then that's what we need to do. We need to scare them maybe, but we need to instill in them they need to be vaccinated if they want to continue to have a life. And the only other thing about life is death. And we've seen too much of that, too much of it.
Thank you so much. Mr. Sean Harvell.
My closing remarks would be to inform, educate, educate. If we continue to do what we are doing, informing, even if it's one person at a time, and getting them to say, you know what, maybe I will go ahead and get this vaccination, because we can only do it one person at a time. As well as what Dr. Close said, the White House, it starts there. They had every industry, every specialist they have talked to, except funeral directors. And I think it's time, as Ms. Hughes said, that they need to hear from funeral directors and see the reality of what did those funeral homes look like during that time.
Okay. Thank you so much. Well, Dr. Harry Close, my brother from another mother.
I receive it, Mr. Mayor, because you from the greatest city in the country.
Absolutely.
I just say to our listening audience, we trust our physicians, we trust our hairstylists, we trust our barbers, and we trust our funeral directors when it's time of need. So together we can survive this COVID-19, this Delta variants, by you just taking the vaccine. That's all I can say. Trust the ones who trust you, and we want to be together.
Thank you, my friend. Well, Dr. T, you can give your last comments and I'll bring us home.
Well, I'm encouraged by what happened here tonight and how we're taking advantage of this Zoom platform to come together, people from all over the country, from different disciplines. And so Harry Close and all the members of your network that came in here today, thank you. Thank you. Because I think that that's part of the reality that we have to address. Now, I've heard something, I don't know if it's true. Sometimes it's with a big broad brush. Black people ain't afraid of dying because they believe there's something better on the other side, but they don't want to suffer. And what we haven't shown is the COVID suffering. Because when the cameras come into the hospital, Dr. Cook and Dr. Ritter, they just do a little thing through the mirror or window. And I see like 8 people just to turn one patient. And I said, look at all of the workforce just to turn that one patient over, and they all in complete spacesuits. So to what extent do we more explicitly share the suffering? And I think it was Mr. Boyd, one of the members who actually had COVID. And I can only imagine when you tell the story of what you went through, it does get people to think twice. Maybe I should get vaccinated, because some of the folks who have made it on the other side through COVID said, I never want to feel that way again. I have never in my life felt that bad. But we don't see that. Maybe we've got to show more. This is not the flu. People are developing diabetes on the other side of the long hauler. So I think we got to tell the rest of the story and make a point that we have to care for these communities beyond stopping an infectious disease. Make a commitment to address those underlying conditions. That can make a difference too. But I'm encouraged, Mr. Omar, that we have to continue what we're doing, and we have to stay the course.
Thank you so much, Dr. T. And as we began to depart from this space, but never from each other, I want you to know how much I appreciate each of you and how much I respect each of you. And for those of you who are out there on the front line as morticians and funeral home directors, we hear you. We hear you and we see you. And we will be an advocate for you, henceforth and forevermore. For our barbers and stylists that have joined us, this forum is your forum, because we know that you want to know. And you want to know because you want to be able to be informed so that you can share the right, correct information with your clients. We know that. And so we thank you for being there and for all you do, both seen and unseen. And so my last word is pretty short and simple. It's let's live through it. You see this notion of COVID does not have to take us out. We now have a vaccine that's the most effective, safe vaccine we have ever created, as far as we know today. And we have the opportunity to not just go through it, but also to grow through it. And so I want us to live through it. And the only way I believe we can truly live through it is that we all get vaccinated. As always, I'd like to leave you with these 2 words. Remember that I love you with a perfect love. But more importantly, remember this. You got the power.
You got the power. You got the power.
Bye-bye.
Don't play with
Thank you all.
Delta. Bye-bye.
Bye-bye.
Wear that mask,
Absolutely.
social distance, and
I love
wash
each of you.
those
Take care.
hands.
Thank you so much, Dr. Close, and to all of the team. Thank you.
Thank you.
Have a
Thank
good
you,
evening.
Dr. Ritter. Thank you, Dr. Tuesday.
Bye.
Bye-bye.
Bye-bye.